I'm Kiana Howard, SPN, and today I'll be demonstrating how you administer an oral medication. So the first thing you would do is verify the doctor's orders, check your patient's allergies, and perform hand hygiene. The 6 rights of medication include right medication, right dose, right patient, right time, right documentation, and right route. After you've identified that, you would gather your supplies, which they are gathered on the table beside me. Next, I would choose my medications. I would verify those 3 times. So I would verify before I remove the medication from wherever it is stored, before I remove the medication out of its actual container that it might be in, and before I administer the medication to my actual patient. So after I've done that and gathered everything, I will also check to make sure the labels are intact, that there's nothing missing with or any debris or anything going on with the medication itself, and check for expirations and all of that. So now that that's completed and out the way, I will next show you how to get pills from a multi-dose bottle. The pills I'll be using are Tylenol, just something I had around the house. So I got my 1 pill that I needed, and I've transferred it to a souffle cup. Excuse me. And that's how you get pills from a multi-dose bottle. High alert drugs include arrhythmics, anticoagulants, antihypertensives, and insulins. Digitalias and Lanoxin, they must be put in a separate cup until an apical pulse is taken. If the apical pulse is below 60, then you must notify the physician immediately. Next, we'll move on to crushing pills. I do not have a pill crusher at home, but I will verbalize the steps and what I'm supposed to do next. So when crushing a pill, you must check the pill crusher for cleanliness and clean as needed. So next, you would get the souffle cup and place it into the pill crusher. Place your pill into the souffle cup, or if you had a bag, you would place it into that, and you would crush your pill until it's a powdered form. I just beat a pill on my table right here because I don't have a crusher. Then you'll get your applesauce, which I have right here. Get a spoon. Place that into the cup first. Measure it out. Then you would take your pill, which I have crushed, which was the Tylenol, and you would mix it in here for your patient until it's a good consistency and completely mixed, and you administer it like so. You do not crush time-released medications, and you would clean the pill crusher according to your facility's policy. So now I will move on to administering liquid medications. For the sake of this video, I will be using water as my liquid medication. So I would put the label in the palm of my hand. I would check the outside to make sure there's no medications around the outside of the container. I would make sure that the label is intact and it has not been altered. So next, I will administer this using a graduated measuring cup, and I will do so at eye level, and according to my calculations, I need 7.5 milliliters. And here I have 7.5. Okay, see that? And here is my calculations. The drug being administered was guaifenesin. To cut tablets, you can only cut scored medications. You must correctly dispose of whatever you may have remaining according to your facility's policies. Before giving an oral medication, you must assess for allergies if your patient is swallowing, and if your patient is NPO for any labs or procedures. After that, I will then ask my patient to state their name and date of birth. I will check their ID band. I will perform hand hygiene. I will have them sit in hot fouls and give them 8 fluid ounces of liquid. After all that is done, I will then document what I have done, the procedure I've done, and what medication I have given them. And after 30 minutes of drug administration, I will come back to check the effectiveness of the medication.